A local doctor voices frustration over the lack of a COVID vaccine for young kids.
Sabrina Wilson talked to a White House COVID advisor about vaccines and the debate over masks for public transportation.
COVID cases may be down in Louisiana, but the physician in chief at Children's Hospital in New Orleans is concerned.
I feel a deep sense of disappointment that we don't have a vaccine for children under the age of 5. There are about nearly 20 million children in that age group. We know that they're at high risk for disease from COVID-19.
Dr. Mark Kline even tweeted, "We have failed our children."
It's the best tool we have to keep people safe, and it's unavailable and it's unacceptable.
I talked to an advisor to the White House COVID-19 response team about it.
What's as far as you know, the possible timeline for getting a vaccine approved for younger kids?
Yeah, I agree that it's concerning that there's not yet a vaccine for kids under 5. And the reason it's concerning is that the virus is still out there. The pandemic is not over. And the only folks right now in our country who don't have the ability to get a vaccine are under the age of 5. So from the administration's standpoint, we really are working as quickly as we can to make sure that there's a safe and effective vaccine available for kids as soon as possible.
Still, Dr. Cameron Webb says the White House won't interfere with the process.
In terms of a timeline, again, the White House it's not our objective to exert a political pressure on these science-based agencies like the FDA or like CDC.
Many kids old enough to be vaccinated aren't.
Here in Louisiana, only about 10% of children in the 5 to 11 year age group have been vaccinated at this point, and about 40% of the kids in the 12 to 17 year age group. We're lagging the national numbers, and so we've got a lot of work to do here in Louisiana.
As for public transit, the CDC says masking remains necessary despite a federal judge overturning the mandate.
The White House's advice today is the same as the White House's advice last week and last month. It's to follow CDC's guidance. It's rooted in science.
Vaccination is the number one tool that we have to protect ourselves, and masks are number 2. Think of it like, seat belts and airbags in your car. The vaccine is the seat belt, and the mask is your airbag. It's another layer of protection.
As cases take up in some parts of the country,
I don't think there's any reason to think that it won't eventually reach us here in Louisiana as well.
And Dr. Webb concedes there may be confusion in the public, so he says that's why they work to point people to accurate information that's rooted in science. Lee.